Okay.
Yes, timer is on, and here is the question. Right, if you have read and understood, kindly begin your history taking.
Hello.
Hello.
My name is Dr. Ishfaq. I am one of the doctors here. May I confirm your name is, please?
My name is Jean. I'm 20 years old.
Okay. Jean, nice to meet you, Jean. Today I have been asked to ask you a few questions regarding your condition. Are you happy for me to proceed?
Yes, sure, doctor.
Okay. Thank you. So, will you please tell me more about your condition? Like, what brought you here to me today?
So I've been suffering for some time now. I've been having the severe tummy ache. It's on my
Okay.
lower side, and and I've also been having some trouble with my bowel movements. I have to go around 4 to 6 times every day to empty my bowels, which is like it's becoming very stressful for me right now. And this has been happening for quite some time now. So, and I've noticed that this pain, it keeps on coming. It aggravates when I'm having food, and
Okay. I'm sorry to hear that you're suffering from this thing. Okay, so I will be asking you a few more questions about it. Okay, so can you please tell me when did you first observe this thing? When did it start?
about 2 years. It's been having from 2 years ago, but now recently it's been becoming more difficult.
Okay, so do you think it was all of a sudden or it was gradual?
It's been gradually increasing, and nowadays it happens 2 to 3 times a day, 2 to 3 days per week.
Okay, so it is increasing, so day by day.
Yes.
Okay, so do you think after opening the bowel the pain is subsiding?
Yes, it does, doctor, it does. I mean,
Okay.
after I eat something, it becomes so much, and then I have to go to the loo, and then I empty, and I'm fine.
Okay. Do you think any kind of anxiety or any kind of stress is increasing this problem?
I'm not really sure. I can't really identify. Recently, I'm not stressed. I don't feel very stressed recently, but actually, to be honest, it's been like 2 years that I had to go through a very rough breakup with my boyfriend.
Okay.
And I noticed the very first time it had happened was 2 years ago, and after that, this has been increasing. But I think I'm getting over it slowly.
Okay, thank you for your answers. So can you please tell me, is there anything which you think is relieving your symptoms?
I can't really identify. Sometimes I do take some painkillers, but they don't help.
Okay, so have you experienced any pain while you opening the bowel? It's relieved. There's tummy pain anywhere in your tummy. Can you please tell me?
It's below my navel, up that area, around that whole area. I feel the pain. Like it's gnawing at my tummy. It's like that.
Okay, so can you describe the pain for me? Like how is the pain? What
calms.
kind
It's
of
like
pains?
it calms, and it's like cramping in there in my tummy.
Okay,
Can you understand? Yeah.
yes, yes, I can understand. I do understand. So, have you observed any blood in your like in your stools recently?
No, no,
Any slime or any discharge while passing stools?
no, not really. But my
Oh,
stool is having a loose consistency though.
yeah, okay, I got it. So, so can you please tell me how exactly is the stool? Like it's watery, it is semi-solid, or it is solid?
It's sometimes semi-solid and sometimes solid. Most of the time it's semi-solid.
Okay, so how has been your appetite recently?
Not good. I don't like to eat much.
Okay, have
I've
you
not been
observed
dieting
any?
though.
Okay, you have been not. Okay, I understand. Have you lost any weight recently?
I told you I don't have a good appetite anymore, and I think because of that I might have thinned down a bit. Yes.
Hmm. Have you experienced any fevers recently?
No, not really, doctor.
Okay, so is there anyone else in your family who is suffering from the same condition or who has suffered the same condition?
No, not to my knowledge, no.
Okay, so so can you please tell me, do you see your GP anything else you would like to tell me? Any other condition?
No, doctor.
Have you had any surgeries in the past?
No, I've never been hospitalized before for anything.
Okay, do you have any allergies?
Not that I know of.
Okay, so I would like to ask you some few personal questions. Will that be okay for you?
Yes, sure, of course.
Okay, what do you do for a living?
I'm a student.
Okay, who is at home with you?
Uh, I don't live at home right now. I actually stay in the campus.
Okay, do you smoke and do you drink alcohol?
Only occasionally, doctor.
Okay, right. So before proceeding further, can you please tell me what do you think what might be causing your these symptoms?
I don't know. Do I have some kind of food poisoning? But it should pass off, right? But it is not passing.
Hmm.
So I'm really concerned.
I appreciate your concern. Is there any other big concern apart from this thing?
Some of my friends been telling me that colon cancer presents like that. I'm really very scared after hearing that. So I came to you today.
I appreciate your concern. So what do you hoping us to do for you today?
Of course, tell me what I'm suffering from so I get a solution for this for good.
Okay, thank you very much for your time. Appreciate concern. I will
Thank you
get
so
back to
much,
you.
doctor.
Okay, thank you very much.
Can you please
I would
enter
like to
all the
summarize
info
my
now? Yes.
yes. Today I have asked history from a 20-year-old girl who presented to surgical OPD with the complaints of intermittent episodes of lower abdominal pain that were associated with the loose bowel momentous. She has been experienced this from firstly 2 years back when she had a breakup with her boyfriend, but
Yes.
from last 2 weeks it's been increasing. She is experiencing 4 to 6 loose bowel movements. It's water inconsistency associated with abdominal pain or abdominal pain. It is increased by taking citrus or and the pain is subsides after taking after her bowel movement. She has not experienced any weight loss or any slime discharge, any blood with her bowels.
Yes.
So
So
based
what
on
is
this,
your
I would like
differential diagnosis?
so my top differential would be the irritable bowel syndrome, but I would
Good.
also like to rule out the irritable bowel syndrome, carcinoma, any ulcerative colitis, Crohn's disease, or any diverticulitis as well.
Okay. Could even be a psychosocial cause. So
It,
what should
it,
be the management?
it I would like to firstly I would like to take some blood investigation this patient and few radiological tests, just like I would take full blood count, urea electrolytes, KFT, LFT coagulation profile, and antibodies for ulcerative colitis and Crohn's disease, as well as stool culture if necessary. And I will discuss my case with the consultant. If required, we can go for colonoscopy as well. I would like to arrange an abdominal X-ray in this patient as well. So after this, I would like to discuss this case with my consultant. And as this case, I'm thinking it's an irritable bowel syndrome due to due to some stress-related factors. So we can we can counsel the patient about the condition, that it's not more serious about it. You have to, we can have some relaxation therapies as well. We can counsel the patient. We will tell the patient to join some supportive groups as well. We can prescribe patients some like some medications as well, like antidepressants, anti-amitriptyline, so SSRIs, and some lactobacillus as well, some gut flora medications as well. So this will be my approach.
Yes, very good. Thank you so much. Considering the age of the girl, you must keep in your differential ectopic pregnancy, because she's
Yes,
young,
ma'am, I
could
should.
be, and she's just
Yes,
having a because ectopic in pelvic can lead to rectal irritation and
Yes.
lose
Yes,
movement,
ma'am.
and it has abdominal
Yes,
pain
sir.
as well. So could be. I don't know. Yes.
There's a point. Yes, ma'am.
Possible. All right. Very good. Thank you. I really loved listening to Dr. Ulfat, your partner. Yeah.
Yes, ma'am. She's so
very
supportive.
superb.
But I have a
Thank you,
suggestion.
ma'am.
I have a suggestion. Dr. Ulfat is like really helping me out. But initially, her answers are a bit longer.
Yeah,
So
but then she narrows them.
that's killing my time.
Yeah,
That's
but
killing
then
my
it's all
time.
right. Today it's a huge improvement, I must say. From last
Yes,
two
ma'am.
times when you were taking 2 minutes extra, today, even with all this delay and all that, just 1 minute extra you took.
Yes, ma'am.
So even that
I'm
will
thankful
come
to you,
down
ma'am.
to, yes,
Yes.
will come down
Inshallah,
to,
ma'am.
yeah. So it's
Yes,
all
ma'am.
right. I consider it's because we're doing it virtual, we cannot see each other, and it's network, and it's many factors. So we consider that.
Yes, ma'am.
So he
Dr.
forgot to ask
Ishfaq,
about ulcer.
ma'am, about the IBD chronic.
Okay.
If you
Because
that
Yeah, but he
amount
asked
to this
kind
thing.
of like if anyone
I
else in the
asked.
family.
Yeah,
Yes,
that is
and
for the colon cancer. And also systemic review that, at the end, just go ahead,
yes,
that chest pain and
I didn't forget it. It was on my mind, but I was running out of time, so
Yeah.
I
okay.
was like,
In
Bell has
that
already
case,
went. Yes.
Dr. Ishfaq, in
Thank
that case, what you do is when you're telling when ma'am said you to present the case, so
Okay.
you continue saying, ma'am, yes, this, I asked this. Due to shortage of time,
Okay.
I could not, I wanted to ask whether the patient has any bone pain, any musculoskeletal pain, anything. Just
Right.
mention it,
Yeah,
so at
at
least the
that moment.
examiner will
Yeah.
know
Yes.
you know.
Yes. Right.
And
You're right.
also,
Thank you very
like
much.
you could say, I would complete my with
Mhm.
examination, because
History
this is
taking,
history taking,
yes.
and then would be
I would.
examination and then investigation.
Exactly,
Yes.
yes, ma'am.
Right. Right.
Thank you
Thank you
so
very
much,
much.
ma'am. Thank you, Dr. Ishfaq. You did amazing, mashallah.
Yes,
That's good.
as
Thank you, ma'am. Thank
expected.
you,
We
Dr. Ulfat.
expect more
As
actually.
expected.
Yes,
Yeah, actually,
Yes,
improve
ma'am,
more,
the
definitely, ma'am.
improve
time,
more. Yes,
Yes,
the
ma'am.
time,
yes,
and
time is
yes,
The
getting
time.
better. Yes, time is
Yes,
getting
ma'am.
better, really better,
yes,
much
time is
better.
getting better.
Yes.
Yes,
And
Yes,
kudos
ma'am.
to
of
you.
course,
Good.
he covers everything within the given time, so it's really tremendous.
Mhm. Yes,
Yes,
ma'am.
ma'am.
Yes.
Yes,
Thank you, ma'am.
yeah,
Thank
like
you,
Dr.
Dr.
Shiman
Ishfaq.
Kumar is saying, yes,
Thank
very
you.
good.